Hello everyone, this is Dr. Smita Mishra and I am from Navi Mumbai, Belapur. Today I thought let me talk to you about a very basic topic, that is oral hygiene maintenance. So friends, I think every one of us, we think that this is not the topic to be discussed because each one of us, we know how to brush our teeth. But friends, I want to make it very clear to you that this is a very scientific procedure, and we dentists spend a lot of time researching products used to for oral hygiene maintenance, the techniques, correct techniques, and how it is going to give you the optimum result to prevent decay in your mouth. So friends, this is a very scientific procedure which we feel or which we know as a simple brushing. So let me talk about brushing. So how many times we have to brush? Everybody knows, twice daily. Once in the morning and once before going to bed. What shall be the technique of brushing? Yes, we also have something called as technique of brushing. Now, when we say technique of brushing, your brush does not have to move horizontal in your mouth, but it has to move circular, covering each and every quadrant of your tooth. Now, what do I mean by quadrant? If you see your mouth and divide it into four parts, left, right upper, right lower, left upper, left lower, and the internal sides of all these sides and the upper surfaces of the teeth. So these are called as the quadrants or part of your oral cavity. So each quadrant of your teeth has to be brushed with the brush held in your hand and in a circulatory motion or at an angle of 45 degree, which is little difficult for everybody to understand and master. So to make it simple, you can just go circular in each quadrant and your brush should be placed near your gums. How much toothpaste I should take? Only a pea-sized toothpaste is enough for the whole quadrant of your teeth. So this is basically the technique of doing brushing. Nowadays we are in an era of our mobile phones, and now we are moving towards AI. So I think we can change our manual brushing to electric brushing, which gives us more efficiency because we have a dual action in that brushes. We have a battery, we have a you can hold it manually, plus it will give a battery operated motion. So electric brush is also recommended. After brushing, brushing is incomplete unless you use a mouthwash. So mouthwash is basically a medicated liquid which is used to swirl around your mouth after brushing so that it reaches each and every part of your cavity where the brush cannot reach. So this is the second part of your oral hygiene maintenance, which is use of a good mouthwash, which the doctor will recommend, seeing your with each individual's case. So 6 monthly visit to a dentist is very important to evaluate all these things. Thirdly, if there are certain indications, if the doctor sees that your gums are swollen, inflamed, bleeding, they may recommend you some tubes, pastes or gels to be applied onto your gums to take care of that aspect of your oral hygiene. Plus also they would recommend professionals cleaning and polishing, which we call scaling. So these are very basic things that one has to do. Brushing, mouthwashing, regular dental checkups every 6 months, get your oral hygiene profile checked, where do you stand, what is the status, which will help the dentist to recommend you further treatments if at all required. These are very important. We call it follow-ups. Follow-ups are very important in dental profession, in dentistry. So friends, I would recommend that each one of us please follow up with your dentist 6 monthly to evaluate your status of oral hygiene. After seeing your oral hygiene profile, the dentist may recommend you certain cavity fillings if they are at their initial stages. They may recommend you some x-rays if they feel the cavities are quite deep enough. They may recommend further treatments upon seeing your x-rays, like root canal treatments or maybe extractions, wherever you stand. So to avoid all these invasive treatments, I would recommend you to please visit your dentist every 6 months for your oral hygiene status. Thank you very much, and for any queries you feel to get connected to us. I'll mention the phone number and the address of our clinic, and you're free to get in touch with us. Thank you so much.